Well, as we showed you earlier, the first shipments of Pfizer's coronavirus vaccine, they are starting to make their way out of Michigan and across the U.S. this morning. That means that we're very close to seeing the first injections in this country. But still, many of you have questions about the vaccine. And to help us understand all of this, we're bringing back our medical expert, Dr. Arnold Baskies. He is the former chairman of the National Board of Directors of the American Cancer Society and also the chair of the Global Cancer Control Advisory Council. Good morning, Dr. Baskies. Thanks for being with us again.
Good morning, Lucy. Isn't that a great picture, though?
It was pretty incredible. Such a moment in history in this chapter of the coronavirus saga, for sure. Doc, the FDA issued the emergency use authorization for the vaccine. That term and just the speed of everything has people leery about the safety of this, especially now that we're hearing reports of people that are allergic, highly allergic, that they maybe shouldn't get it. Clarify what all this means.
Yes, Lucy, that term emergency use administration can evoke some fear, but the fear is really being misdirected. We have 3,000 people a day in this country. Think about that, 3,000 people a day dying with COVID, which means that until we get this under control, we could potentially lose 120,000 of our friends and family per month. We have two choices: either get the vaccine or you will get the virus. An EUA or an emergency use administration order is an old term dating back to 1938, which gives the FDA the authority when there's a threat to lives and safety of our people to allow for certain use of certain things under the conditions such as we are right now. Consideration for a vaccine is a reasonable alternative under an EUA when there is that threat. In the history of vaccines, there's never been a more open approvals process than this vaccine's approval process. In fact, you could have watched the whole approval process on Facebook. The reason we have an EUA is that it may be effective under standard use, and the totality of the scientific evidence available makes it reasonable to believe that this product, this vaccine, is effective for the specified use. Now, in this case, the Pfizer vaccine has been very well studied, and there have been no serious side effects that have been proven to be present. So the FDA has issued a go-ahead for distribution, and it couldn't come in a more timely fashion.
Doc, there's so much to ask you just on that one topic, but we have to move on to this question too. Once people get that first dose, how quickly is it going to protect them? And we've heard that people still have to wear a mask, still stay 6 feet away after they get the shot. Tell us why that is.
Well, for most vaccines, Lucy, it takes about 14 days to acquire immunity from the vaccination. And that appears to be the case with this vaccine. Until you acquire that immunity in 14 days, you can actually carry the virus and still be infectious. So wearing a mask until that period is over makes a lot of sense. And since there is still a 5% chance of getting the virus even after you've gotten the vaccine, until we have herd immunity either from natural infection or from the vaccination, social distancing and mask wearing is advisable.
And Doc, real quick, once a medical worker gets this, are they going to have to take days off of work after receiving the vaccine? Is that part of the policy?
That will be the policy, and the reason is very simple. There's always a reaction to a vaccine. If you get the flu vaccine, the shingles vaccine, we know that you get some local irritation, you can get some fatigue, some muscle and joint pain, and some elevated body temperature. That being the case, you don't want to vaccinate your entire hospital staff at the same time. You want to phase it in, so if people have to take a day or two off after they've gotten the vaccine, then you have adequate personnel. So it'll be a phased-in vaccination program at every hospital.
Wow, so much on them. All right. Doc, thank you so much, as always, for joining us and sharing your insight.
Thank you, Lucy.
And you can count on NBC10 to get your answers to your vaccine questions. By all means, post it on our NBC Philadelphia Facebook page. Tell us what you want to know, and then watch all this week coming up as we get you those answers. So